All right. Hey, everyone. Welcome back. Nursing school, you're learning about all sorts of medical conditions and treatments, but there's nothing quite like facing an emergency situation head on, right?
Oh, absolutely. It's where all that knowledge you've been soaking up gets put to the test. And today's deep dive is all about those emergencies where quick thinking and decisive action are absolutely critical.
We're talking about poisoning, skin contamination, and food poisoning, all situations that you're very likely to encounter as nurses, especially in a busy emergency room setting.
And we've got some great source material to pull from, packed with insights and practical tips to help you feel more prepared when those moments arise.
So we're going to break down the essentials,
Yeah.
the signs and symptoms, the assessment steps, the treatment protocols, and the critical thinking skills that'll set you apart as a confident and capable nurse.
We'll cover the science, the procedures, and the little things they don't always teach you in textbooks.
Exactly. So let's jump right in. I think most people have a general idea of what poisoning is, but our source material actually defines it in a really interesting way.
Yeah, it's not just about swallowing something you shouldn't, right? It's broader than that. It's anytime a harmful substance gets into the body and disrupts those normal processes no matter how it enters.
Okay, so we're talking about more than just like ingesting something toxic. It could be inhaled, absorbed through the skin. What else?
Even substances produced within the body can become poisonous in certain situations. It's all about dose and context. Like, even water can be toxic if you drink gallons of it too quickly.
Wow, that's a good point. I never thought about it that way. So it's not just about what they were exposed to, but also how it got in there and how their body is reacting to it.
Exactly. And that's why a really thorough assessment is so crucial in poisoning cases. You got to be a detective, figuring out the whole picture, the substance, the route of entry, the symptoms, and the potential for complications.
Speaking of treatment, our source lays out these universal goals for managing poisoning, regardless of the specific cause. Like, what are the guiding principles in these situations?
Right. So first and foremost, you want to remove or neutralize the poison if possible. Basically, stop it from doing any more damage.
Okay, that makes sense. So if someone swallowed something poisonous, you might try to pump their stomach, right?
Yeah, that's gastric lavage. It's not always necessary, but it can be really effective in certain cases, especially if it was a recent ingestion.
Okay. And what about activated charcoal? I know that's used a lot too.
Absolutely. Activated charcoal is like a magnet for toxins. It binds to them in the stomach and intestines, preventing them from being absorbed into the bloodstream.
So it's like a safety net, catching those poisons before they can wreak havoc.
Exactly. But removing or neutralizing the poison is just the first step. Next, you've got to focus on supporting those vital organs that might be under attack. Poisoning can affect pretty much every system in the body, so you're monitoring their breathing, their heart rate, their blood pressure, all those vital signs really closely.
You're basically keeping their body going while you fight the poison,
Right.
like buying them time to recover.
Exactly. And if there's a specific antidote available for the poison, that's like your golden ticket. Think of naloxone for opioid overdoses. It's pretty remarkable how it can reverse the effects of those drugs.
It's like hitting the reset button, right?
Yeah.
But what happens if there isn't an antidote for this specific poison?
Then it's all about helping the body eliminate that toxin as quickly and safely as possible. That might involve IV fluids to flush the kidneys, medications to enhance elimination, or even dialysis in really severe cases.
Okay, so we've got remove, support, antidote, and eliminate. Those are our four main goals in managing poisoning. But I imagine it gets way more complicated when you're actually dealing with a real patient.
Oh, for sure. Each type of poisoning presents its own unique challenges, and as a nurse, you need to be able to quickly differentiate between them because that's what's going to determine your next steps.
Right, like it's a triage puzzle, figuring out what kind of poisoning you're dealing with so you can take the right action.
Exactly. So our source material breaks it down into four main categories: ingested poisoning, inhaled poisoning, absorbed poisoning, and food poisoning. And we're going to dive into each of those in more detail.
Okay, let's start with the one we probably see most often in the ER, ingested poisoning.
Yeah, this is that classic scenario of someone swallowing something they shouldn't have. And it can range from accidental overdoses on medications to a curious toddler getting into cleaning products under the sink. You'll even see cases of intentional poisoning, which adds a whole other layer of complexity.
Wow, so the stakes are already high. What are some of the key things a nurse needs to be thinking about when they're faced with a possible ingested poisoning case?
Well, first, you've got to rely heavily on that initial assessment. Ask the right questions to get a clear picture of what happened, what was ingested, how much, when did it happen.
You're basically playing detective, trying to gather all the evidence.
Exactly. And don't underestimate the power of a good physical exam.
I imagine you're looking for those telltale signs that something is wrong.
Right. Yeah, but here's the thing. Those signs and symptoms can vary so much depending on the substance that was ingested. You might see vomiting, abdominal pain, changes in mental status, seizures, even cardiac arrhythmias.
Wow, so it really is about connecting the dots between the substance, the symptoms, and the potential complications.
Right. And that's where your knowledge of toxicology comes in. You need to understand how different substances affect the body and what kind of damage they can cause.
You're not just treating the symptoms, you're treating the poison itself.
Exactly. And that might involve a whole combination of those interventions we talked about earlier, gastric lavage, activated charcoal, antidotes, supportive care. It all depends on the situation.
Okay, let's shift gears a bit and talk about inhaled poisoning. This one always feels a little scarier to me because you can't always see the poison.
Yeah, it's the silent killer category. And a perfect example is carbon monoxide, from faulty heaters, car exhaust, house fires. It's odorless and colorless, so people often don't even realize they're being exposed.
And it's incredibly dangerous, right?
Oh, it can be deadly. Carbon monoxide binds to hemoglobin in your red blood cells, the stuff that carries oxygen throughout the body. But here's the problem. It binds way more strongly than oxygen does. So basically, it takes over those red blood cells, making them useless for carrying oxygen.
So your body is literally being starved of oxygen, and you might not even realize it's happening until it's too late.
Exactly. And to make matters worse, a regular pulse oximeter won't pick up on it. It'll show that your blood is saturated, but it can't tell the difference between oxygen and carbon monoxide.
That's terrifying.
Yeah.
So you could have someone who looks and acts relatively normal, but they're actually in a really dangerous situation.
That's why a good history is so important. If someone comes in with those flu-like symptoms, especially during the winter months, you always want to ask about possible carbon monoxide exposure.
Okay, so let's say you suspect carbon monoxide poisoning. What happens next?
You need to order a specific blood test that measures carboxyhemoglobin levels. That's the hemoglobin that's bound to carbon monoxide.
So that gives you the confirmation, and then it's all about getting them fresh air and 100% oxygen, right?
Right. The oxygen helps displace the carbon monoxide and allows those red blood cells to start carrying oxygen again. And in severe cases, they might need hyperbaric oxygen therapy.
That's where they go into that special chamber with high-pressure oxygen, right?
Exactly. It helps flood the system with oxygen and get rid of that carbon monoxide much faster.
Okay, we've covered ingested and inhaled poisons. Let's talk about absorbed poisons. This is all about skin contact, right?
Yeah, like chemical spills, industrial accidents, even something as seemingly simple as getting pesticide on your skin while gardening. Right. And we're not just talking about a little rash here. Some of these substances can cause serious burns, tissue damage, and even systemic toxicity if they get absorbed into the bloodstream.
So I'm guessing decontamination is a top priority in these situations.
Absolutely. You want to flush the affected skin with copious amounts of water. We're talking like a full-on shower situation for at least 20 to 30 minutes. You really want to dilute and wash away as much of that chemical as possible.
And I imagine you're also removing any clothing or jewelry that might be contaminated, right?
Oh, absolutely. While that's happening, you're also assessing the extent of the damage. How deep is that burn? How much of the skin is affected? Are there any signs that the poison is starting to affect other parts of the body?
You're basically treating the burn, but you're also watching for signs that the poison is spreading.
Exactly. And the treatment's going to vary depending on the severity. You might need to apply topical treatments, give pain medication, even transfer the patient to a burn center for specialized care. All right, we've tackled the big three: ingested, inhaled, and absorbed poisons. But we can't forget about that other culprit that sends people to the ER in droves: food poisoning.
Ah, yeah. I think everyone's been there at some point. Food poisoning, it can definitely ruin your day, to say the least. But it's not always life-threatening, right?
Well, that's true. But sometimes it can be a lot more serious than just an upset stomach.
Okay, so what are the key things nurses need to know about food poisoning?
Well, first, it's important to understand that it's caused by those tiny little troublemakers, bacteria, viruses, or toxins that contaminate our food.
So it's not the food itself that's poisonous, it's those little bugs hitchhiking a ride.
Precisely. And those bugs can cause a whole range of symptoms, from mild nausea and diarrhea to severe abdominal cramping, vomiting, and even dehydration.
Okay, so let's say a patient comes in with suspected food poisoning. What are your first steps as a nurse?
Just like with the other types of poisoning, it all starts with a really detailed history. What did they eat? When did the symptoms start? Was anyone else who ate the same food also sick?
So you're playing food detective, trying to trace it back to the source of the contamination.
Exactly. And that information is crucial, not just for treating the individual patient, but also for potentially identifying and stopping an outbreak.
Wow, so it's about public health too, not just individual care.
Right. Now, in terms of actual treatment for food poisoning, the focus is often on supportive care.
Okay, so making sure they're comfortable, managing their symptoms, and helping their body recover.
Exactly. Rehydration is really important, especially if they've been vomiting or having diarrhea.
So IV fluids are probably pretty common in these cases.
Definitely. You'll also be monitoring their electrolyte levels and maybe giving them meds to help with the nausea and vomiting. But sometimes supportive care isn't enough.
When do you need to do something more?
If it's a bacterial infection, like Salmonella or E. coli, they might need antibiotics. And in some rare cases, like botulism, they might need antitoxins to counteract the effects of the toxin.
So even though food poisoning might seem like a common, relatively minor illness, it can actually be really serious in some cases.
That's why it's important to never underestimate the potential severity of any poisoning case. You've got to be prepared for anything.
All right, so we've covered a lot of ground here, laying the foundation for understanding different types of poisoning and the basic principles of management.
We've talked about the importance of a thorough assessment, the key interventions, and the potential complications.
But now, it's time to put all that knowledge into practice. In the next part of this deep dive, we're going to walk through some specific scenarios and see how you, as a future nurse, would handle these emergencies.
Get ready to test those skills. This is where the real learning happens. All right, so are you ready to put all this knowledge to the test? Let's walk through some real-life poisoning scenarios and see how you, as a future nurse, would approach these situations.
Yeah, bring it on. It's like those nursing school simulations, but with even higher stakes.
Exactly. Okay, so picture this. You're working in a busy ER, and a frantic mother rushes in carrying her toddler, who's drowsy and disoriented. The mom says she found her kid playing with an open bottle of her prescription pain meds. What are your first thoughts?
Okay, so first, my heart would definitely be racing a bit,
Oh.
but I tried to stay calm and remember my training. It's a classic accidental ingestion case, and with a child this young, the effects of those meds can be really serious.
You're already thinking like an ER nurse, prioritizing the most vulnerable. Now, what are your first steps? What do you absolutely have to do right away?
Okay, first, assess the child's airway, breathing, and circulation. Make sure they're stable.
The ABCs, it's drilled into you in nursing school. And for good reason. They're the foundation of emergency care. Okay, while you're doing that, what are you trying to find out from the mom? What questions are crucial?
Well, definitely what medication it was, how much was in the bottle, when did it happen, how much did the child take, and of course, any allergies or other medical conditions.
It's like detective work, gathering all the clues. Okay, so you're getting all that info. You're assessing the child's ABCs. What physical signs are you looking for that tell you this is opioid toxicity?
Well, with opioids, I'd be looking for drowsiness, pinpoint pupils, slowed breathing. Those are kind of the classic signs. And in severe cases, they might even lose consciousness.
Exactly. Those are all red flags. Okay, what interventions would you consider? What options do you have in this situation?
Um, if it was a really recent ingestion, we might think about gastric lavage, try to pump some of the medication out of the stomach. But that's really time sensitive, so it depends on when it happened.
You're thinking critically about the timing. Good. What else?
Activated charcoal's another option. It binds to the medication in the digestive tract, prevents it from being absorbed into the bloodstream.
It's like a sponge for those toxins, right? And in a situation like this, you have the benefit of a potential antidote. What is it?
Naloxone. It's incredible for opioid overdoses. It can reverse the effects of those opioids and, save their life.
It's pretty amazing. But naloxone is a temporary fix. You have to remember that. Close monitoring is still crucial because it wears off.
Right. You don't want to get complacent. You got to watch for any signs that those opioid effects are coming back.
Exactly. And while all of this is going on, of course, you're providing supportive care, oxygen if they need it, making sure they're comfortable, keeping the parents informed and calm.
Yeah, it's definitely a lot to juggle, but that's emergency nursing. Okay, let's switch gears and picture a totally different scenario. You're working the night shift when paramedics bring in a young couple found unconscious in their apartment, and there's a strong smell of gas in the air. What's going through your mind?
Hmm. Walk me through your thought process here.
Okay, first, that gas smell is a huge red flag. And then unconscious. Definitely thinking carbon monoxide poisoning.
Hmm.
But first and foremost, I got to make sure the scene is safe, both for the patients and for the whole healthcare team.
Safety first. You don't want to become another victim. How do you ensure that?
We'd contact the hazmat team right away to secure the area and contain the gas leak. No point in rushing into a potentially dangerous situation.
Exactly. Prioritize safety every time. Okay, so the scene is secure. What are your next steps for the couple?
It's back to the ABCs, making sure their airway's clear, their breathing, and their circulation is okay. And then we need to get oxygen on them stat.
You got it. High flow oxygen is essential here, but you also need to confirm the diagnosis, right? You can't just assume.
Of course. We'd order a carboxyhemoglobin level to confirm carbon monoxide poisoning and figure out how severe the exposure was.
And while those tests are being run, think about the severity. They were unconscious. Are there any other interventions that might be necessary?
Yeah. Since they were unconscious, we definitely consider hyperbaric oxygen therapy.
You got it. That's the most effective way to get those carbon monoxide levels down quickly. Okay, excellent thinking. You're demonstrating those critical thinking skills and your knowledge.
Yeah, these scenarios definitely show how every poisoning case is different, and you have to be able to think on your feet and adapt to the situation.
It's not just about memorizing protocols, it's about applying your knowledge in a dynamic, real-world setting. All right, one more case to test your skills. This one's going to challenge you to think outside the box, especially in a resource-limited setting. Ready for it.
All right, so imagine you're working in a rural clinic, one of those places where you have to be ready for anything, and, resources might be a little limited.
Oh yeah, talk about being resourceful.
Yeah.
You're definitely going to be using all those critical thinking skills.
Okay, so picture this. A farmer comes in. He's just spilled a strong pesticide all over his arm. He's in pain. The skin is red, blistered. It's absorbed poisoning. What's your first move?
Okay, safety first, right? I mean, pesticides can be really dangerous. Got to protect myself. First, gloves on before I even go near him.
Smart move.
Yeah.
You don't want to become a patient yourself.
No.
Okay, and in a rural clinic, you might not have a full hazmat team standing by. So what's the next priority?
Decontamination. Get him away from that pesticide. If any of it's still on his clothes, we got to get those off carefully. And then lots and lots of water. Flushing that skin for a good long time. I mean, like 20, 30 minutes at least.
I'm picturing a garden hose situation at this point. But yeah, every second counts. What else are you thinking about while all that's happening?
Okay, so I need to know how bad that burn is, how deep, how much of the arm is affected, and we need to find out exactly which pesticide it was.
Because that'll make a difference in the treatment.
Oh, yeah, absolutely. And with pesticides, you got to be worried about systemic effects, too. They can get absorbed through the skin.
So you're not just treating the burn itself. You're thinking about what's happening inside his body, too. What kind of things are you looking for?
Well, it depends on the pesticide, but, changes in his breathing, his heart rate, blood pressure, even his mental status could be affected. Some pesticides mess with the nervous system, the lungs, the heart.
Okay, so you're watching his vital signs closely, but you're also paying attention to the whole picture, how he's acting, his skin color, all that.
Exactly. And we'll make sure his pain is managed to chemical burns. They really hurt.
Okay, you've decontaminated him. You've assessed how bad it is. He's stable.
Yeah.
What happens next?
Well, here's where that resourcefulness comes in. Rural clinics, we don't always have everything a big hospital does. I got to decide, can we handle this here? Or do we need to get him transferred?
That's a tough call, especially in a life or death situation. What factors go into making that decision?
It all depends. How bad is the poisoning? What's his overall condition? What resources do we have here at the clinic? If I'm not comfortable managing it, or I think he needs more specialized care, we got to get him to a bigger hospital.
It's knowing your limits and advocating for your patient to get the best possible care, even if it's not with you.
Right. It's a team effort. I might be the first one to see him, but I'm not alone in this. I can call poison control, talk to specialists, make sure that transfer goes smoothly.
So real good communication is key, right? Not just with the patient, but with the whole team.
Oh, communication is everything, especially in emergencies. You've got to be able to get your point across clearly and quickly to everyone involved. Paramedics, nurses, doctors.
And it's not just about the medical stuff. It's also about being there for the patient and their family emotionally.
Oh, for sure. I mean, these situations are scary. Taking a minute to explain what's going on, answer their questions, just be reassuring. It can make a world of difference.
Okay, so we've covered a lot of ground today.
Yeah.
What are some key takeaways for all those future nurses out there?
Well, first, remember that poisoning can happen in so many ways. It's not just about swallowing something dangerous. You got to be ready to spot those signs and symptoms.
And then, the treatment depends on how that poison got in there. It's all about those four goals: remove, support, antidote, and eliminate.
But every case is different, so really pay attention during those assessments. Be a good detective.
Channel your inner Sherlock Holmes. And remember, you're not alone in this. You've got your team, you've got resources, so don't be afraid to ask for help. You got this, future nurses.
You're going to be amazing.
That's it for our deep dive into emergency nursing and poisoning. We hope you learned some valuable stuff and maybe had a little fun along the way. Until next time, keep learning and keep those brains firing.